The dynamic contour tonometer, or DCT, is a slit lamp mounted contact technique for measuring intraocular pressure. Unlike the Goldmann tonometer, the DCT has a curved surface. The cornea is not applanated, and therefore the effects of corneal resistance to deformation are reduced. This minimises the corneal effect on the IOP measurement.
Now I'm going to check the pressure of your eyes using the dynamic contour tonometer, and to prevent cross-contamination I'm going to use a silicone tip. And I'm going to place this in the device and mount it on the slit lamp, ready for use. And if you could come forward, please. Put your chin on there. Is that comfortable? Mm-hmm. Eyes wide open. That's great. Sit back, please. So this patient's intraocular pressure is 12.6 millimetres of mercury with an ocular pulse amplitude of 1.9 millimetres of mercury and a quality reading of 2 out of a possible 5, where numbers 1 and 2 can be accepted, but a quality reading of 3, 4 and 5 should be discarded.
The DCT is a contact technique for measuring IOP. Rather than applanate the cornea, it matches the contour of the central cornea. Studies have suggested that it is less affected by variations in corneal thickness compared with the Goldmann tonometer. The Reichardt Ocular Response Analyzer, or ORA, is based on the non-contact tonometer. It measures the corneal response to a rapid jet of air. The ORA gives a measure of the corneal biomechanical response. This will be discussed further in your lectures.
Now we're going to measure the pressure of your eyes using this device. If you could come forward and pop your forehead on there, just so your nose touches gently on there as well. That's very good. Now look at the green spot in the middle of 4 red ones. It's going to take 3 readings. Well done.
The green line represents the air pressure increasing and then reducing, and the red-blue lines show the applanation events as the air pressure rises and then falls. The second applanation event occurs at a lower air pressure compared with the first, and this has been attributed to the cornea's viscoelasticity. The cornea is acting like a shock absorber, absorbing and then dissipating the force of the air pressure applied. This corneal property has been termed corneal hysteresis. Reichardt have also determined a corneal response factor which they incorporate into the IOP reading, resulting in a corneal compensated IOP measure. On this printout, IOPG represents the standard Goldmann equivalent IOP reading, whilst IOPCC is the compensated one. This subject has a highly viscous cornea, and you might remember they also had quite a thick cornea. So, the true IOP of this subject will be overestimated when using the Goldmann. Here, the IOPG is significantly higher than the IOPCC, reflecting the effects of corneal properties on IOP measures. However, further research is required to establish the true value of IOPCC.